No, 8.
Or just 8 or 8 series?
8 episodes. Okay.
Well, this thing going there?
Yeah, I'll put them in. Yeah. No, I'm not washing anything now.
No, what you got with the post, you got to put it in with the washing.
Oh, no, you just put it, just do it.
Well, that's what I'm.
Oh, I see. Yeah, I'll do that myself.
You want me to do
Yeah,
it?
I'll do it.
What program do I put it on there?
One 30 minutes or maybe
Sorry?
28 minutes. I don't know.
You don't
I'm
know.
not sure. 28. I need to read this. See what program I.
You just put one in there.
Yeah. I don't know. Well, when I was the video of it, you put one tablet and turn the machine on. Okay, do that then, Steve.
Hello, everybody. Thank you so much for joining us.
Good afternoon.
Hi. Well, I'm Anne. I'll do sort of proper introductions at 2 when we'll just wait and see. I know there's a few more people who are hopefully going to join us. But does anyone have any questions just in the meantime?
No.
No. We'll just give everyone a few minutes. It's great so many of you have been able to take time out. I know it's really busy. Life's always so busy, isn't it?
Hi, Anne.
Hi. Hello, Margot. Thank you. I'm so glad you're here. I'm just getting just a couple of slides up, although it's nothing to do. Oops, sorry. Okay. So I know we've got Eve coming. Most of you probably, well, I don't know if most of you know Eve. She's the Chief Nursing Officer. Oh, you're here. Sorry, I can't see everybody. Sorry, Eve.
No, it's all right. Don't be daft. It's fine.
I've got you now. I've got. It's great. There's so many people here. Trying to get. So I'll say it again at 2 when we start. But we have got this set to record. I'm hoping everybody's happy with that. Because we won't be recording the whole session, but we do want to record the presentations and questions and answers around those. I'll open the chat bar because I often forget to do that and read the chat that's going on. Great, we've got quite a few more people joined us, which is fantastic. Sarah, you're in the office.
For 30 minutes, yep.
Oh, fantastic.
And then I'm gonna juggle.
Okay, fantastic. So I'm mindful everyone is so busy, and some people may join us later but want to make a start as it is too, and that's when we said that we would start. So just really wanted to welcome everyone, say thank you so much for coming. It's fantastic that you've been able to. I'm Anne Butts. I've been a registered nurse for 39 years. I spent all my career, other than two, when I was was that a question, or is that just someone's got their mic
No,
on?
I think it's just
Someone's got the mic on. Okay.
Yeah.
So yeah, I've spent all of my career, other than 2 years I nursed in America, the rest of my career has all been in the NHS till now. But I had the absolute honour, it really was a privilege, during COVID, when we all were doing 101 other things, we were in the NHS as well. And one of my reassigned roles was I worked for Torbay in South Devon NHS Foundation Trust, and it was working with care homes in our footprint on the Enhanced Health and Care Home Framework, which was just, it blew my mind. I just couldn't believe what you were managing in care homes and how you were adapting to COVID and the care. And I've always been very passionate about personalised care. That was my last role in the NHS, was personalised care improvement manager and coach. And the personalised care that I was seeing in care homes was just phenomenal. So I just jumped at the chance to be able to come and do some work with social care. So thank you so much for having me here. The ask from Devon Care Home Collaboratives was a nursing clinician forum, being mindful of how tight everybody's time is. You're just all so pushed on time. You've got so much skill, experience, and for some sort of shared learning and opportunities for CPD development through that. So my role will just be to facilitate, because I've never worked in care homes. I am very, very far from any sort of expert. And we had meetings where, as hopefully you all saw, it wasn't a lot to notice, but we did invite people to an engagement meeting to look at what would be beneficial with these forums. We decided on asking subject matter experts, and we're hoping some more of you will come forward for areas you have of interest there. But subject matter experts to present for about 20 minutes, maybe a bit less, maybe a bit more, on a topic for the month. We'll do 1 hour every month. And then questions and answers, but then we would turn the recording off and we would move to sort of open discussion where we all have a chance to kind of share. You can share experiences, challenges, blockers, enablers, best practice, just anything that we can really help with mutual support and engagement. So I will just quickly share my screen. So the first session today, so say welcome, and a massive welcome to Eve Carder, who, as I say, hopefully a lot of you will already know. Absolutely inspirational. First time I heard Eve talk, I just thought, wow. So she's going to talk to us about the social care nursing, you know, how it's relating here to what we're talking about in these forums, about leadership and supportive networks. We have developed a number of templates we really wanted to share with you. Those we can put in, I'll put in the chat now and we will share at the end. But one is about feedback from these sessions, because we're going to run them monthly and we really want them to reflect what's going to be of benefit to you. So we want to hear, is the format right? Are the topics right? How you feel about the way that they're being run. That's the feedback evaluation. And then the reflective learning is one where you just, if you want it, it's just for your use, but just thinking about our personal development requirements and NMC code of conduct. We just thought we could identify what the objectives from each of these sessions are, and we could pre-populate those into a kind of, well, this was the session, this was how long it was for, this was the subject matter expert's title, these are the objectives we looked at, this is how it relates to the code of conduct. And then space for you to add your own reflections, as we all have to do, about how we will apply that to our practice, what we've learned from it and things like that. So we'll share those. I hate to say the ground rules, because we're all professionals, we all know the ground rules, but it did also seem appropriate, being the first session, that we should just set those out. So the fact that we really want this to be a safe learning space for sort of positive and productive learning experience for us all. Confidentiality, we're all so okay with confidentiality, but not sharing afterwards anybody that could identify what somebody had said unless we've got their express consent to do so. Obviously, we're all going to come from very different learning experiences, very different personal experiences. So the whole bit about maintaining respect for everyone's views and experiences, learning from each other, thinking about those experiences and expectations and our different perspectives that come from a result of those, and how we can support each other from those. Encouraging everyone to participate. A huge part of the benefit will be the participation after the subject matter expert presentations. But I'm also very mindful that for some people that's very easy to put your hand up and share something, other people it's not. You know, please do put your hand up and be part of discussions. If you don't feel able to, but you're happy to put in the chat bar, put things in the chat bar. If you've got things you just don't want to say during the meeting, message me afterwards. You know, we can look at those to make sure that we're incorporating the learning from everybody. And ideally, please put your cameras on, but be on mute if you're not speaking. I know, thank you for you popping on there. I know myself from, you know, presenting, it can be very daunting just presenting at black screen, because you don't know is, and I also know that, you know, often it's because it's the only chance we've got to eat some lunch. But I know personally, if I'm presenting, I'd rather be able to see someone's face and know they're eating the lunch than think, well, have they gone to take the dog for a walk and they've just left their camera on? So if you're able to, I appreciate not everybody's able to, and some people don't have cameras on their laptops and things, but if you're able to, please do keep your cameras on for as long as possible. Are there any questions to any of that before I go on to just do a couple of quick introductions? And is everybody happy with that, and that what they were expecting roughly to come to today? I know being the first session, it's hard to know. Yeah, brilliant. I will introduce Steve, so say a lot of you will know her. We also have on here Bav and Sophia from Indigo. So I've only just started working for Indigo, who are working with Devon Care Home Collaborative to put these forums together. They did laugh at me when I naively said last week, could someone from IT please join the call in case there were any problems? Like that. You're not in the NHS anymore, Anne. Who is this IT? But they very kindly joined in case I have any problems, and just to support generally. And also Margot, I'm sure you all know Margot. Margot and I've had a couple of conversations about these forums and how we may be able to sort of work together going forward to, you know, it's that the sum is greater than the total of the parts. You know, we really want this to be an engaged forum and to be working with people who have the expertise in the area. So I will hand over to Eve, if that's okay, Chief Nursing Officer for Evolve Care Group. She's one of those rare people who seems to have 10 days in her week and 36 hours in her day. Don't know where she gets it from, wish I did, but does an incredible amount of things. So Eve, are you happy I pass over to you?
Yeah, thank you. Thanks, Anne, for the introduction. Just for introducing the whole forum so well. There's a huge gap in social care that people need to have that space to be able to think, speak, talk collaboratively. And just I think out of all of those three areas, I think sort of the space to think is probably one of the most important. Just background on me, I do quite a lot of teaching up in Bristol. Don't do a huge amount of teaching on Teams, and I find it really, very strange to sit in front of a computer and smiling, because she's seen me walking up and down sort of the rooms and sort of engaging with people, and it's, yeah, still, even after all of these years after COVID, it still feels very strange to sit and actually chat on a computer and not have people that you can actually touch and feel within the room. So just bear with me on that. So I wanted to come this afternoon and just talk about social care nursing as an introduction to this forum, what it means to me, how it's been very much part of my life, but also how great the need is for social care nurses, more now I think than ever before. So I have put a short presentation together. Please, if you've got questions, please just interrupt, put your hands up. I'm not precious on anything like that at all. I may throw back a couple of questions to you guys, so please just sort of answer, no pressure again if you don't want to, but equally if it doesn't make sense what I'm saying, please, I'd rather you stop me and go, hang on a second, doesn't quite make sense, as opposed to go away and thinking, okay, what was that all about? So please, just very open and honest in that way. I will have a go at sharing screen. So I've called this the magic of social care nursing. For me, nursing homes and social care can be incredible places, incredible teams when done very well. I think the privilege that we have to be part of people's journey that come into social care is something that I personally, feel very honoured to have. It gives us the opportunities to make relationships, sustain relationships, meet families, change focuses of hope, use our clinical skills, use our clinical expertise, see other people actually sort of, come up the ladder and gain that expertise and knowledge through the time that they spend with you. So for me, social care nursing is endless in terms of possibilities. I do feel that still that as a group, we need to be able to present social care differently in order to guarantee the future of the social care workforce. There feels as though there's still a very misaligned perception that social care nursing is easy, it lacks leadership opportunities, it lacks pathway specialisms, and there's a real myth still, isn't there, that social care nursing is easy and it's far less challenging than nursing in a hospital setting. The reality for both, I'm sure everybody on this call would agree that it's a misaligned perception and the myth is the exact opposite. We talk about support, we talk about leadership, and very clear that leadership's the underpinning block in social care nursing, that without leadership, that actually you don't have a joined up team, you don't have a joined up approach, and you can't even begin to achieve some of the amazing possibilities that you can when you're working collaboratively. Does leadership need a title? No, I think that can be quite a controversial statement, but I think that I can look back over my years and I've seen some staff that have no title at all when they join social care, but have the most incredible leadership skills that they don't even realise they have. And what I've seen over the last 10 years is that ability to be able to grab hold of those people and actually bring them into that clinical forum, that clinical education, those clinical opportunities, and give them an opportunity to develop. I do strongly believe that nursing's an art. I don't think it is just a job. I think personally, for me, definitely, it's a way of life. It's part of who I am. But I think the art is in the fact that you can be creative within social care, that you don't have the constraints that sit on a hospital NHS nurse. That there's so much opportunity to work autonomously, think outside the box, and look at things in a very different way and present things in a way that I don't believe is possible within the constraints of the NHS. That's not a criticism. I think it's just a very, very different field of nursing. When I say about the leadership in social care, I've put a couple of names up on here. That may be a home manager, maybe a clinical lead, a registered nurse, care practitioner, nurse associate. I don't think necessarily, or I strongly don't believe that leadership is about how long somebody is being in post for. I think some people have a natural behavioural trait towards leadership, and I think others can actually be supported to learn those. And I guess one of the questions that I wanted to ask you guys today, that within your clinical field of social care, have you got somebody that's inspired you at some point? Can you think of somebody within your clinical, within your nursing career, within social care, that you've worked with somebody and you've thought, actually, yeah, I want to be like that. I want to model that behavior. I want to have that impact on people. I want to be able to develop people in that way. And I guess my question is, what behavior did they model to make you think like that? What was the behavior that you saw in that leader that you thought, yes, that's going to be me. I'm going to be aspire to be like that. The behavioral traits in a social care practitioner, that thought that you have in your head now from that person that inspired you, is that captured in any of the pointers up on this slide? Does anybody want to come in?
I was just going to say mine is. Oh, okay. There's more.
No, go on. Sorry.
I'm a care practitioner in a home, and Sarah is my manager. But there's a lot of different traits in her that I see, which makes me want to achieve more. So, for example, if there's ever feedback given, it's always that we'll do this as a team. It's us as a team. Trust is always built. It's always you know that you can go to her, and there's no blame culture. It's always portrayed in that way, that you're never singled out, even though if there's a group of us, you know, you may be one that have done the issue. Yeah. It's always done with, we're going to do this together. We're going to look at it this way. We all take the blame together. So I always look at that and think, I hope that I can portray that as a leader then to the team underneath, because it makes you more approachable.
Oh, that's great. Thank you, Rachel, for sharing that. Thank you. It's so in that leadership qualities, we all need a role model, don't we? Yeah, all of us, whether that's from a small child to a teenager to an adult within your workplace, but to actually have somebody that you can look up to and think, actually, yeah, that I want to learn how to behave in that way. I want to understand more. Does anybody else want to share their thoughts that are on the call in terms of who's inspired you as a leader within social care? Or who inspired you to become a nurse? Hi.
Hi, Eve. It's Margot. I just thought I'd join in. I think you inspire us, actually. I think you're a total inspiration during COVID. All the work that you did for infection control was incredible. So I just want to, I've never really thanked you, but thank you for all of the help that you gave us, certainly. So yourself, but I asked this very question to some of our team during training, and it always surprises me how few people are actually inspired by anybody. They don't really think about it, and yet it's so important, isn't it, to have someone to look up to sort of copy, to look at how they do things, how they achieve results, and I think it's a really key question, because they're people, the people who inspire us are the people who urge us to look for answers and be curious about further things. So I think it's a really good question. Who inspires us?
Thank you, Margot. And just, I think for me, that like all of the work that we did in COVID and what have you, it was about working as that team. And I think that's one of the biggest things in social care nursing that you actually get to do, although there's a lot of autonomous practice, isn't there, but the ability to be able to come together as a group and actually change things that, you know, people said wasn't possible was an amazing, was a privilege. So I think you're right in terms of like the time. I don't think people do think about actually who is that person, how do I want to model, how do I want to change my behavior. And I think Anne summed that up brilliantly at the start of the introduction, that part of this forum is about having that space to stop and think. You know, everybody's so busy, aren't they? And if people can leave each session, each forum with one thing that actually, can I do this differently? Can I look for this? You know, can I start to use those skills? And I think together, I think we can, you know, achieve a huge amount over this time together. I wanted to also link this back.
Sorry, Eve, I was just going to say there's one more hand up.
I'm sorry, I can't see. I can't see at all.
Sorry, there's Stacey. Sorry, Eve. Do you want to jump in, Stacey?
Yeah, hi. I basically wanted to say that I've had many nurses over the years give me like inspiration, and I've learned a lot and all that. But I must say, you are one that has actually believed in my own ability and pushed me beyond my what I thought was my ability. So for that, I thank you. But yeah, I must say I have learned a lot over the years with every experience, and it's been a pleasure. So yeah,
And
well, I wanted
thank
to
you,
say that
Stacey.
that's
But yeah,
right.
okay, so I wanted to link this back to the NMC code, that I think sometimes it gets lost in the sense that leadership is a fundamental part of that code. And I wanted to share, just through this short presentation, just really through that slide that we've just sort of looked at the different behavioural traits, how that can fit into the NMC code, and how people can be part of, and actually in terms of that reflective practice when you're, managing situations, leading situations, dealing with, sometimes really tricky situations on your own, aren't you? It can be lonely out there at times as a nurse in social care or a nurse associate or a care practitioner. That in the hospital you have a team of people around you, don't you? There's nurses on the next ward, there's doctors at the end of the phone. Sometimes some of our clinical team I know can be waiting sort of half an hour, 40 minutes just to speak to somebody, let alone get a call back. So in terms of that leadership, how do you guide your team at that point? How do you keep people calm? You've got to prioritize people. Yeah, you need to make sure that your practice is effective, that you are preserving safety, and actually that you are promoting professionalism as a registered nurse to both outside professionals and your team. We took some direct areas out of the code and actually mapped it back so that people could actually see how, that fundamental, that underpinning building block of leadership can be mapped back to the code that people can use. I think there's a huge number of points in the code that you can match back, but I think sometimes it can make it quite real for registered nurses. And sometimes I think people need to be able to see the link between the code of practice. We all talk about medications, don't we, and accountability, but actually there's not often much talked with regards to leadership and how that fits and how that can make a difference. These slides will obviously be available afterwards if people want to sort of use anything from their own practice, their own revalidation. Social care is easy then, is it? Social care nursing is easy, which is still the myth that I think a lot of us hear, both in the press and news and just within the local community. I was sat in A&E a couple of weeks ago watching the nursing staff, and if I'd have had a uniform in my back pocket, I would have got involved. I could not believe after 5-6 hours of sitting in the majors area of A&E, the number of elderly people that were simply just walked past, and it was not because people didn't have time. I was fortunate enough to be sat very close to the nurses station, and I heard conversations literally about nights out, holidays, and where we were buying our latest bikinis from. And you'd got elderly people that would have absolutely flourished from actually having somebody just sit and just hold their hand and just be with them and actually make a thorough assessment of that person in order to be able to inform the doctors that were seeing them to actually plan their care, implement that, and get them back home to the right place. They could have been an advocate for that person. There was no emotional safety created, and there was very little physical safety. But what I did see was elderly people stuck in A&E that were absolutely fearful and must have had just a whole sense of being lost, and it was really sad. And as I say, it wasn't because there wasn't time, it was the fact that the culture within that setting, and of course it's a different culture to social care, of course it's a different culture to nursing homes, but actually as a nurse, as a care practitioner, as a training, as a nurse associate, as a carer, it doesn't matter, does it? This is about people. And I think people get lost in the system, and it was really sad to see that. So when there's that myth that social care nursing is easy and we don't have that much to do and we don't have that much clinical expertise, I think that, yeah, society is still very, very misinformed about that. I wanted to share on that note with you what we as a team have put together in terms of what is the expectations of a social care nurse. I'm sure we could add to this, and maybe over these next the peer forums that happen, maybe we can add to this and actually look at coming up with one collaborative, because I'm sure I've missed areas off. But this is a snapshot of the areas where I have an expectation that the social care, nurses and our care practitioners manage and work within all of this fit every single time they come into a care home. And people say that this is easy. People say that there's not a career pathway. I think the career pathways in social care is endless, and then there's an amazing career ladder to progress if you want to do that. The pathway specialisms that you could talk at that I've just listed on here have go from one end of quite extreme mental health conditions to some very complex physical nursing management, whether that's tracheostomies, whether that's somebody with particular complex PEG management, catheter care, dysphagia. The list is endless. The fact that as a social care practitioner that you're expected to understand about frailty, understand how to pull information together and critically analyse that to be able to share that with an MDT, knowing that MDT could actually define somebody's pathway going forward. So in terms of, is it easy? I think we'll probably all very much agree on this call, it's not, but it's actually how do we work together? How do we upskill people, give people the space and the time to really appreciate actually what skills are needed in social care and give people the support and the leadership to be able to achieve that. I wanted just to finish on 5 areas that I think social care do very well. And that is that as a registered nurse, if I was to summarise what our roles are as registered nurse, and this is obviously personally for me speaking, is the focus of social care nursing is on prevention of ill health physically and emotionally. It's about preventing hospital admissions. It's about enabling the person and their next of kin and their families to have time to understand what's happening, or at least at minimum accept what's happening. The absolute ongoing belief that by working through some of the pathways on here around assessments, that we can reverse frailty, and we can support people to make significant recoveries through targeted interventions. If we get our assessment, our planning, our implementation, our evaluation correct, we can achieve that. And we manage a huge amount of long-term health conditions to enable people to live well. Thank you for listening to that. I hope there was some useful parts on that, and thank you for those of you that either sort of vocalized and came forward in that presentation, or just sat and thought about different things. But yeah, I appreciate your time. Thank you. Anne, I'll hand over to you.
Eve, that was amazing. Thank you. And it's so true and lovely to hear people say that they've been inspired by you. The first time I met Eve was at an Evolve training session, and the value that was given to everybody participating was phenomenal, and everybody was encouraged to have equal voice. And I remember Eve just whispering to me at one point, "Who do you think that is?" And I said, "I'm guessing one of your care home managers." And it was one of the staff that prepares the meals. But the teamwork and the fact that everybody was valued and encouraged to come forward with all their ideas, hopes, observations, and absolutely treated equally in that, and had such a strong voice. That was my appalling perception, that I jumped at the expectation from the way someone was talking. They're probably a care home manager, and it was a real eye-opener to me. And I think that's reflected in the comments that people have made, Eve, about your leadership and what you were saying about what's important in leadership. But anyway, Margot, come to you first.
Thank you, Eve. That was really good. Great, thank you. And it's I think when somebody does a presentation like this, as you say, it just allows us to stop and think about what we're doing and what our accountability is and the importance of our role. I would love to add to it, if I may. I hope that's okay. But
yeah, of course.
Just the area that I think we're always a little in danger of forgetting is the importance of that emotional care for some of our elderly people that we look after, and the importance of that psychological support, and not only really for the residents, but also the team, and checking in on the team and making sure they're okay. Because if the team are not okay, then they won't give their very
nothing
best
happens
to everybody else. And so I suppose really in Southern Healthcare, we always sort of think about the team first, really, and make sure they're all well and functioning happily, and they're all, you know, content in their jobs before we can expect them to really do an amazing job, which they do every day. And that appreciation of the team for all the work they do, you know, that is really incredible most of the time. So I'm just saying that emotional element is so important.
It's critical, isn't it? And it sits as a you know, a key foundation block in all of that. And we will often say to, and I'll say to sort of, you know, the staff that I speak to every day, and that's mostly the leadership staff, is in the home managers, nurses, care practitioners, that I can't affect change in the home for the individual person that's living in every single home. I can't make a direct change for that person, but I can, and I hope that I do enable the change to come through the leadership of that senior team. And that's the same within the staff within the home, isn't it? That the nurse on duty can't directly impact change on every single person in every single shift. If you're managing a care home with 40 people, you cannot make an holistic assessment of 40 people every day. But you, through your leadership, through your inspiration, how you gather information from your team and the support, Margot, exactly what you're saying, making sure that they're okay, you can enable your team to make those assessments and come back to you. I often say to the teams that as a registered nurse, you give your PIN number to the team every day. And you say, look after that for me. Give me back at 7:30. I used to make a joke of that, you know, don't forget that 97CO471E number, that belongs to me. But for today, I'm going to give it to you. And, you know, because we do take the word of our teams, don't we? And say, actually, no, so-and-so hasn't got any pressure damage. They're not anxious this morning. We absolutely don't need anything, you know, brilliant connections, etc. So I think sometimes it's about making that message clear, isn't it, about the trust that you put in people to make the magic happen.
That's brilliant, thank you. I am really sorry, this is appalling of me to start with. I didn't introduce Sarah, who originally I thought wasn't going to be able to join the call, but Sarah's equally involved in, will be, you know, developing these forums as we go along. Sarah, do you just want to do a quick intro? And I think if it's okay, I will turn the recording off now, because as I was saying, I don't imagine we're going to be saying anything that people aren't happy to share, but I just want people to know that this is a safe space. You know, we sort of want to look at how we can support each other to move things forward in a positive way, but feel it's a safe space to make those any observations they may wish to. But Sarah, I'm so sorry.
That's okay,
Would you? I suddenly thought just after we'd started, like, how could I not introduce Sarah? I'm so sorry.
No, that's absolutely fine. And I think we were both sort of blown away by how many people are on the call today, because, you know, with it being the first one, weren't really sure, you know, how many people had seen the flyer and might, you know, have the time to come and engage and just have a look and see what we you know, what we're looking at. But yeah, my name's Sarah Butfield. I've been a registered nurse for 40 years, same as Anne. Worked in the social care setting in many different specialties over the years, and I've also worked for NHS 111 as a clinician. So being pathways trained in triage is a skill that I now bring to my role as a